Hello, a warm welcome to CREST.BD's Bipolar Wellness Centre webinar series. This webinar will provide you with a summary of current research evidence on the relationship between identity and quality of life, as well as pointing you to some tools and resources to help you establish a stable sense of self.
Welcome everyone. My name is Dr. Nasreen Khatri. I'm a clinical psychologist and researcher at the Rotman Research Institute in Toronto. Today we'll be talking about identity and bipolar disorder. So the focus of the webinar will be on defining identity, why identity is important to quality of life, identity and BD, and how you can take action. Defining identity. Everybody has a unique sense of self or identity. It encompasses all the meaningful roles, relationships, characteristics, values, commitments, behaviors, and associations about ourselves. Whether or not we live with BD, a solid sense of identity is important for health and quality of life. At the same time, as we grow from life experiences, our identities grow with us. Why is identity important to quality of life? Well, we understand or interpret the world through the lens of our own identity. So it gives us our own unique perspective on things. And the way that we see ourselves actually can shape who we are. So for example, if one sees oneself as being caring and helpful, one is more likely to actually behave that way in a situation that calls for it. So it's kind of an interaction between how we see ourselves in the world and how we behave. So identity and BD. Emotional turbulence of BD can challenge finding a stable sense of self. Because BD can involve such dramatic changes in moods, from being very, very excited and happy or irritable and angry to feeling very low or down, and everything in between, it can strain the ability to maintain a consistent sense of self. For example, there could be a negative identity when one is feeling depressed. You may view yourself in an exaggeratedly negative way and be extremely focused and stuck on your flaws and worried about what other people think and feeling sensitive to criticism. Perhaps when you're feeling manic or hypomanic, you feel that you have a very positive identity, perhaps more positive than is really accurate. So as this slide shows, the gentleman who's focusing in a very positive way on his own reflection. But studies show that people who have an accurate sense of self and can judge their abilities and characteristics accurately are actually the ones who have the best quality of life and a very stable sense of self. Some people with BD describe the onset of BD as a disruption in their life story and identity. As you can imagine, having such wild mood swings or episodes where a certain mood predominates for a period of time, whether it's a very high mood or a very low mood, can impact how people actually see themselves because it's so out of the ordinary for them. And it's only human to want to integrate all of our experiences into our sense of self. Some people describe a process whereby they reevaluate their sense of self. So if they do something that's really outside of the norm for them, for example, going on a spending spree when they're manic, they may have a hard time trying to integrate that into who they think they are and how responsible they feel they are. So there can be mixed emotions of guilt, shame, and sometimes other negative thoughts or a feeling of loss of the person that you thought you were. Disruption may be even more critical when BD occurs in youth because identity is still being discovered and solidified, so it's difficult to tell whether one's mood swings are a part of an emerging self or if they are always going to be out of character for that person. But some people do experience BD is actually being transformative or life-altering because they've been able to widen the spectrum of behaviors and experiences and emotions compared to what they were like before. And it can be something that maybe gives them perspective, empathy, wisdom, and a sense of richness about their emotional life and their life in a behavioral sense as well. So let's talk about role engulfment. Identity becomes entirely based on one aspect of yourself or one role that you fill, and you undervalue or ignore other aspects and roles. So for example, I'm a parent, a caring friend, I care about the environment, and I live with BD. That is a more balanced view than saying that you are your illness. You have strengths, characteristics, values, and goals that go well beyond your BD. However, there can be times in your illness, especially when coping with a difficult mood episode, when focusing almost solely on managing your BD can be an effective strategy to regain health and wellness. How can you take action? You can. With practice and commitment, develop insight into who you are versus what aspects of your behavior come from BD. One way to do this is to actually sit down and make a list, to write about the kinds of behaviors, thoughts, and emotions that you have inside of a manic episode or inside of a depressive episode, and put them side by side, and then make another column about how you see yourself integrating experiences and experiencing emotions between episodes. So the aim is to develop a stable, positive identity that keeps you in touch with the full range of your values, abilities, and roles, rather than focusing only on limitations placed on you by your BD. Try to develop a sense of self beyond your illness. Make a list of your characteristics, values, roles, strengths, and abilities, interests, priorities, habits, in 2 columns. First, list those related to BD. I suffer from rapidly shifting mood, or sometimes I go on impulsive spending binges. 2, list those not related to BD. Example, I enjoy playing tennis, or I'm a helpful person. 3, most of your characteristics are not caused by BD. Remind yourself that you are much more than bipolar. BD can be seen as something I manage, not who I am. Teach yourself and others to tell the difference between normal changes of emotions and mood episodes. You can be excited or happy, for example, without being manic, and you can be sad and frustrated without being depressed. So it's important to let yourself have a full range of emotions without fearing that you're falling into one or another kind of mood episode. It can be very important to feeling supported and validated by others. So teaching ourselves and teaching others what is kind of the norm for us in terms of mood variability really helps us to feel comfortable in our own skin and be able to interact with others with confidence. Identify negative self-messages about your BD. For example, having BD means I'm flawed. This is an example of self-stigma, when people feel that they themselves are kind of down on themselves about their illness. So before somebody else can kind of have any stigma or about it, you yourself are saying that. Cognitive therapy can help to identify negative thoughts that are unrealistic, unfair, or unhelpful, to challenge these thoughts and to replace them with thoughts that are more realistic, fair, and helpful. For example, having BD means I have some mood challenges in my life, but it doesn't mean that I'm a flawed person, which is more realistic and more accurate and gives you a chance to be able to manage other aspects of your life in a positive and confident way. Instead of approaching your BD as one huge overwhelming problem, try thinking of it as a series of specific smaller problems which you can manage using your creativity, problem-solving ability, personal values, skills, strengths, and social support network. Remember that friends, family members, and healthcare providers can help you with this endeavor. One way, again, is to make lists and write down specific things about BD that are the hardest for you to manage, and get help managing those things. Be able to talk to others about them and get the support you need. When exploring your different characteristics, be gentle and accepting with the parts of yourself that you would like to change. And this goes for all of us. So it's important to be kind to oneself, because that's a very important part of self-acceptance, self-love, and of quality of life and feeling comfortable with oneself. So we may all have things that we're working on or parts of ourselves that we would like to change, and it's no different for people who have BD. Being critical towards yourself causes unnecessary hardship. Being kind to yourself can help to give you strength and can even help you make changes for the better. If you would like to make changes in your life, explore what values are important to you. So for example, we could take kindness as a value. So if you want to make changes, that's a good place to start, because you may want to act more kindly to yourself. For example, not being down on yourself for having the illness. That would be an act of kindness towards yourself. And towards others, perhaps you would like to be more helpful or volunteer. And so our identity helps us to articulate our values through our behavior and to act on them. There's no perfect or correct set of values. Everyone has their own unique values that they consider important. Make a list of the ones that make you feel that you feel are important to you. Once you have your list, try making realistic, specific, and attainable goals that support each value. Tools and resources are so important in dealing with BD and managing effectively. Some resources are the following: Living with Bipolar Disorder and Finding Your Identity. An interesting article written by someone who lives with BD suggests actions that you might follow to care for your identity and actively define your own life path. The Problem with How We Treat Bipolar Disorder, written by Linda Logan for New York Times Magazine. It's a personal story about losing and finding yourself with BD. For more information and resources, visit our Bipolar Wellness Center. And to assess your quality of life, visit our Quality of Life tool. So I wish you the best on your wellness journey, and I would like to really extend a big thank you to the Canadian Institutes of Health Research, who make the research that we do at CREST.BD possible and allows us to have webinars like this and other education and reaching out. So thank you so much.
Thank you, Nasreen, for that. It's now time for the question and answer session. Nasreen, the first of these says from the webinar participant, I see that you're an expert in cognitive behavior therapy. Are there any CBT type approaches that I can use to help strengthen my sense of self living with bipolar disorder?
That's a very good question. Actually, there's a wealth of information about cognitive behavior therapy related to bipolar disorder, and I do have experience in that clinical area. So maybe I can just lay out a few tips. The first one that we use in cognitive therapy is kind of more of a behavioral tip, which is rating one's mood. So rating it, 3 times a day, let's say in the morning, in the afternoon, in the evening, and keeping a rating log. And just kind of, there's no right or wrong, but you'll find your own anchor. So for example, emotions that often are involved in bipolar disorder, so it could be anything from excitement, lack of energy, anxiety, sadness, any of those things, and then rate them maybe from 0 to 100, and then keep track. So it's different when we look back and try to evaluate our mood, but one way to monitor mood in a more accurate way is to do it in real time. So that's one of the things that we use is a mood rating log. And another one, which was talked about during the webinar, is making lists. So making lists about our characteristics that we want to work on, things that we feel are a core part of our identity, and other aspects of our identity that come out when we're in one or other episode in BD. And so that can also be helpful. How's that, Erin?
That was great, Nasreen. I was happy to hear you talk about the importance of capturing the mood in the moment and how that can help with the accuracy of the reporting. I remember being in a training session once that said that, if you're describing mood states after the fact, it becomes a story of how you remember that mood state. And you talked in your webinar about the power of identity on, in terms of the way we interpret our environments. And so in terms of really learning to accurately capture our moods and describe them, I'd really endorse the importance of that in-the-moment reporting.
Right. And another thing that we ask people to do often in the context of BD is to write down what you were doing. So activity levels and type of activity and mood often go hand in hand, for all of us really. So that's another kind of anchor to the mood rating, and it gives your clinician, if you're seeing one, and yourself, lots of information week to week.
And I'll just mention for the people on the line that if you missed the mood webinar that we ran, you can listen to that again in June, or you can go to the Mood Center of the Bipolar Wellness Center and you'll find some of the best mood rating and tracking scales available for your use in that section. So another question that's come through, Nasreen, which is asking, do you have any tips for helping teens with establishing a solid identity or sense of self?
Yeah, I think, as I said in the webinar, it's difficult to know if many of the experience that people have in adolescence can be quite kind of dramatic to oneself or very impactful, and it's hard to know if that's part of an emerging identity or if it's part of a mood disorder. So again, we want to rate moods, rate activity levels, and look at the severity and the range of mood and how long those moods last, because they also help us in diagnosis. So it's really important that even from a self-management perspective, that the youth or their parents or someone who is involved with them can help them keep track of their moods so that they can understand that as being part of the sort of regular aspects of adolescence, which can be quite stormy at times, but also separate that a little bit if they're experiencing struggles with emotion, so that they learn to separate those things early, because as I said, often people self-stigmatize, and so we don't want that. We want people to be able to see the separation between a mood disorder and just growing up and having moods and intense experiences that are often part of teenagehood.
And the next question segues on quite nicely from that and asks about people who are having their first break or developing bipolar disorder in later life. We know that the majority of people who experience bipolar disorder have the onset of the condition in their teenage years or early 20s, but there is a subset of people who really develop the condition in, you know, sometimes their 50s, 60s, or 70s. And so what can that do for a person's identity?
Well, it can do a lot of things for people's identity. One of the things that happens is that it seems to be very disruptive for other family members because they've known this person, if it's an adult child of this person, for example, they've seen them as a certain way all their lives, for example, or even other members of their family. So it's difficult for others sometimes to integrate. So it's good to have a family session with somebody who is having a first break or a first episode later in life. Another very important aspect, as you were saying, Erin, that can happen in the 50s, 60s, and beyond, is that it's important to get accurate and good differential diagnosis. And here I'm talking about any type of early occurring dementia, such as frontal temporal dementia, which actually can express itself with bipolar-like symptoms, especially those of mania and disinhibition. And so it may actually be a mixed syndrome, or it may be purely bipolar disorder. So I think it's really important to have a very good clinical and cognitive assessment at that time. And then I think it's the same once treatment begins as anyone else, that they need to learn the facts about BD, the medications and treatments that help, and then also the self-management treatments such as cognitive behavior therapy to be able to integrate this sort of change, if it's a bona fide BD, into their lives and going into the later years of their lives.
Sage advice, thank you. The next question asks, sometimes for me the differences between normal changes in my emotions and the onset of a mood episode are subtle. Do you have suggestions for ways I can teach my friends and family members to recognize the difference?
Yes, that's very important. I think one of the things that we focus a lot on in cognitive behavior therapy, both in unipolar depression and in BD, is finding your own relapse signature. So as you are going through a treatment, or as you are just going through life, keeping track of your moods, generally speaking, even if you're feeling euthymic or really quite well and stable, it's a great time to start graphing and start rating your moods on a daily basis, just as you would in writing in a journal, so that when you hit a rough spot, you can have a better sense of the kinds of things that happen to you when you are becoming manic or becoming depressed. Another way to do it is to make lists of the kinds of things, and sit with your family or sit with your friends and say, well, what kinds of things do you think start to happen? So in every sense, how does my thinking appear to you? How does my behavior or energy or activities change? And how do my emotions seem to be changed? And then I think you really get a sense of something brewing that's more than just a moodiness or having a bad day or a very good day.
And I think, I don't know, from my clinical experience, from what the research tells us, Nasreen, it seems like for many people their relapse signatures are fairly stable over time. So if you can put the energy into focusing on what are your very personal early warning signs for, you know, dangerous or dark times ahead, that the next time you might not be able to detect the episode at that point, but the next time you might be better armed to do it. And those relapse signatures can stay quite consistent over time for some people.
They really do, and that is, I agree with you, that's what the studies show. The other thing that tends to be pretty consistent is triggers. So understanding the kind of stressors that are more likely to kind of move you into the realm of you know, a BD episode, as opposed to a minor stressor that you can handle. So for example, it could be something like a relationship difficulties or financial problems, or you know, work stress that is especially difficult for you to overcome.
And I guess that segues into identity as well, in that, you know, if you have beliefs around, for example, being particularly susceptible to certain triggers, that may be accurate in itself, but going back to what you were saying in the webinar as well, that, you know, you don't want to become creating a kind of prophecy where you are priming yourself for triggers to come in many ways. So it's almost like walking a fine line between those two things from the sound of it.
Definitely. I mean, the way I look at it is, you know, forewarned is forearmed. So we don't want to become, you know, sort of handle ourselves with kid gloves, but we do want to have a sense of self-understanding and identity. And identity is shaped by the kind of the narrative that we tell ourselves, and we just want that narrative to be informed with evidence, you know, from our own lives.
That makes sense. To what is the final question at this point, unless somebody else has any remaining ones, but it's a big one to end with, Nasreen. The person on the line asks, can you recommend ways to challenge other people's stigma towards people with bipolar disorder?
Yeah, that's a very profound question. I think one really needs to start with oneself and ask yourself, what are the kinds of stigma that you feel you have towards BD yourself, and that you have witnessed in other people growing up or seeing it in the media, and then kind of trying to unpack that a little bit and try to understand where it might be coming from. So why do people feel that this is something that needs to be isolated or something that isn't good? Well, maybe they've come to that view because they're worried that it's a social contagion, that if they're around somebody who has episodes of mood, that they might develop them. So being able to be armed with information and facts about what BD is and what it isn't, or any mental disorder for that matter, and then also maybe just kind of understanding, even though, I mean, even from a clinician's perspective, when people find out what I do for a living, sometimes people are taken aback. And I always kind of take it with a grain of salt, because I know that it's really just fear. And so what's one of the things that really dismantles fear and dissolves it is knowledge. So I think being knowledgeable yourself is really going to hold you in good stead, because it's also going to make you more empathic and understanding about other people, where they're coming from. Because I think it's really not willful. I think it's just that people are afraid at times, and they needn't be.
Wonderful, Nasreen. I think that's the end of the questions that we have, but I want to thank you for that really informative question and answer session, and for the people who posed questions to us on the line today as well. It was a rich discussion. So I just need to end with a special thank you to Nasreen for this really insightful presentation on identity and bipolar disorder. Thank you very much, Nasreen.
You're very welcome, Erin. Thank you.
Thank you. Goodbye, everybody.